Hi, guys. I am ready to talk with you about the next stage of digestion, which is your esophagus. So, let me just pull it up because it's going to be a lot easier if I just show you that, just right away. So, let's do this. And we're just going to use this slide right here. So remember how we were talking about the digestive tract? There's different phases. We talked about the mouth. Now we're into the stomach. So up here, if you can see with my little pointer, you're going to see food's going to come in through the mouth. You'll go chew, chew, chew. Then it's going to come down here into this esophagus. And the esophagus is this like muscular tube that takes things from here, down into your stomach. And it uses a muscular contraction to help kind of move on through. It's like they call it peristaltic movement. And essentially what it means is it like contracts like this in order to help push food down. So we had two things. Remember, we were talking about with getting, food from the mouth to the stomach. And the one thing we talked about in mouth was, remember, that lubrication. So the saliva helps to lubricate it. And then it's actually called a bolus, right? So once we take food and we chew it up, then it's called a bolus and we swallow it. Anyway, you don't have to really know that. What's important to understand though is that we have that combination of saliva and then we have this muscular contraction, this tube kind of working this through. One of the things that I think is really important and a reason I wanted to point out the esophagus kind of independent of other things is there's some nerve supply that takes place in there. So we have some cranial nerve supply that happens right back in here that allows for that swallowing process. This nerve is called the vagus nerve. So when the vagus nerve becomes affected, we can start to see things like difficulty swallowing. We can actually see like difficulty in digestion as well. We can even see like, kind of heart palpitations or chest flutters and stuff because the vagus nerve, they called it in school, they always called it the wonder because it supplies many different things. But this particular nerve will have some relationship there. So, if you or someone that has difficulty with swallowing, this could potentially be, some issues there with that nerve. The other aspect of it is that I'm seeing a lot more these days. People are saying that the esophagus, like the size of the esophagus, is getting smaller. It's like, so there'll be patients saying, "Hey, I have to go in and get stretched out to kind of open up that space again." What's interesting is there are eosinophilic reactions that can cause it as well. They're like allergic reactions. So if you notice that you have trouble with that, like, one of the things that I always encourage my patients to do in addition to getting their checkup is, hey, let's make sure that we do a food log to support this as well, because maybe that contraction here is actually kind of like an allergic reaction to a food that you're sensitive to. When you put it in, it causes that constricture and swelling off of it. So this is like really important because if that gets really like that, I mean, it's going to be very uncomfortable. It's gonna be really hard. And then, the other thing is, if you don't have that proper usage of the mouth, might it be hard to swallow things? Yeah, if you can't chew things and break them down to really fine, particles, it's going to be harder to swallow them as well. So that was the next stage of it. We're talking about esophagus, talking about the nervous system supply to it. And I think one other thing we should also mention, I don't want to get too in detail for you guys, but there are different form of cells that line the esophagus. Okay, so if a patient has what's called acid reflux, or something along those lines, where the acids from the stomach are coming up into the esophagus, they can actually change the size and shape and structure of the cells lining the esophagus. This would be known as Barrett's esophagus and can potentially lead to things like cancerous lesions and stuff like that. So we can see that in really the top ones are going to be acid erosion, and then two, smoking. Yes, smoking is not good for you, not good for you, not good for you. But a lot of times patients don't even realize that they're having minor symptoms of reflux. So it is something that we should be considering. What are the symptoms of reflux? And I think we should go into and do a little topic on that as well. Maybe we'll make that the next one. So type your questions and comments about the esophagus down below, and I'd be happy to try and answer them the best that I possibly can. Otherwise, stay tuned for the next one.